With so many options, why choose Arizona State University?
For me, the only online option was ASU because of the quality. Their faculty was really involved with their students and care about your personal journey. The dedication to my personal development from my professors, that's been extremely valuable to me.
Earn your degree from the nation's most innovative university. Online. That's a degree better. Explore more than 300 undergraduate, graduate, and certificate programs at asuonline.asu.edu.
People really don't know what their expenses will be because they don't know how long that they're going to live.
Americans are worried they won't have enough saved for retirement now more than ever.
Retirement's going to cost for many folks over $1 million.
Is no sure thing in investing, but a lot of people think that annuities may come close to that.
It's going to more safe things that they know. If they know they're going to need that money to supplement their retirement, well, then you can't play that risk.
This is the Safe Money and Retirement Show with Jon Heischman Sr., founder and partner of Heischman Financial Services, serving the Columbus and surrounding areas. Jon specializes in educating pre-retirees and retirees about safe money strategies and ideas. Now, it's the Safe Money and Retirement Show. Here's Jon Heischman Sr.
Good morning and welcome to the Safe Money and Retirement Show. I'm your host, Jon Heischman. Thanks for taking the time before your day gets started. So, questions about today's show or any questions relating to investments, retirement, planning, the number is 888-426-0177. Again, 888-426-0177. I always welcome the opportunity to receive your questions, your concerns, and many times radio listeners will call me with their questions, and we take a couple of minutes or as long as it takes to discuss over the phone. You should take advantage of that because there's no cost and there's no obligation. It's something I really enjoy doing. Building healthcare cost into retirement planning. You know, healthcare planning, it's a sensitive subject that often takes retirees to a place where they don't want to go. A lot of times, it's not addressed by agents or advisors, but given rising expenses, no retirement plan is complete without some type of provision for healthcare needs. So I thought it would be a good topic for today's show because it can create surprises in retirement, which obviously we want to avoid. For example, who does and does not have to enroll in Medicare at age 65? And what happens if you don't enroll in Medicare on time? How does private insurance work with Medicare? And what can you expect to pay after enrolling in Medicare? Very important to know because healthcare costs are rapidly emerging as a major expense item for those before and during retirement, with lifetime employment a relic of the past and the longevity risk on the rise. You must be aware because it could be the biggest expense in retirement. Therefore, retirees need to be educated and know the importance of their health status, how much they need to save to cover the costs in retirement. Not only are healthcare costs a huge factor in retirement, but they also are becoming a larger concern for pre-retirees. Those of you who are pre-retirees and looking to retire within, let's say, the next 5 years, the more you know, the more you're educated about your options and cost, how the system works, your coverage you can expect to receive is critical. I recommend that I have a discussion with my clients on every annual review. No retiree should assume that costs are under control. And no matter what the age of the client, healthcare in retirement needs to be continuously discussed and reviewed. There are a number of issues surrounding healthcare and cost that you need to be aware of, including the impact on how you're going to take care of yourselves and the impact it's going to be. What is the potential you're going to face and the cost? What is the projected increase in cost, which needs to be built in to your retirement plan budget? Another issue that needs to be addressed is maintaining your health. And I personally do think there's more emphasis on wellness today compared to our parents when they were in retirement. The better your health, typically, the less you'll spend on healthcare cost. And that is obviously going to free up dollars for vacations or fun stuff that you like to do during retirement. And previously, there wasn't a lot of good information to quantify that impact on your wallet. But now, today, there is. And so many times when we talk about healthcare cost, we're thinking about premiums, the cost for Medicare increase. However, out-of-pocket costs need to be addressed as well. Today, there are different plans, high premiums, low premiums, or no premiums. What plans cover most everything? And what plans have a large out-of-pocket cost per year? I think projected out-of-pocket costs are so important because here's where a lot of surprises come into play. Out-of-pocket cost should be built into your budget. If you change plans, the budget can be adjusted and the premium cost have to be addressed as well. I think it's important to review your coverage during retirement often. Get a comparison. Keep your current plan honest as far as, do I have the best premium for the same coverage? A good example would be most of our retiree clients will have their Medicare supplement coverage through our firm. We're able to review all of the company's benefits and cost annually to help them keep the premiums and out-of-pocket cost at a minimum and without jeopardizing coverage. And we do welcome your calls if you would like a comparison, as well as discussing your healthcare cost needs. And many times we will recommend keeping your current plan because of the cost and benefits. But if you don't shop it and compare it to the many other options that are available today, you're not going to know if you've got the best plan at this point in your retirement. 888-426-0177 is the number to call to see if we can help and discuss your options. I'll give you that number again, 888-426-0177. Pre-retirement health care issues. It used to be that healthcare costs were pretty negotiable for most American consumers in pre-retirement. Pretty much all have worked for employers that provided very generous healthcare insurance packages. That's changed. Now, even those who are employed can't necessarily count on health insurance, and even those who do not have health insurance never know when their insurance company will be changed, their premiums and coinsurance increased, or if their providers are going to be changed. Here's some things you need to consider. For those that are not retired or getting ready to retire, which can assist in the planning process, out-of-pocket healthcare cost. I recommend tracking those costs, building those costs into your projected budget. What about individual healthcare insurance policies? Now, for those that are healthy, there's some decent options out there. For the not so healthy, one thing that needs to be addressed is pre-existing conditions. And what about navigating COBRA? When you leave your employer, it's an option to continue health insurance until you find another job or retire. Another issue to consider is high deductible health insurance and health savings accounts. All of these need to be considered. A lot of times when we talk to a pre-retiree that is considering retiring, let's say in the next 5 years, but won't be age 65, let's say for another 8 years, picking the right coverage can be extremely expensive. And to the point where the conclusion is they need to continue to work because of their health insurance. I like to say when you turn 65, you're home free. And in many cases, you'll have the lowest premium with probably as good or better benefits than you had. But getting to age 65 is the problem. And like I say, many will continue to work until they can get to that magic age. But you need to know the options. You need to know what's in store for you down the road. Otherwise, it's going to change your planning and you're going to face some surprises that I don't want you to have to do. I'm going to take a break at this point and continue with this important issue when I return. Stay tuned. I'll be right back. With healthcare costs expected to continue to increase faster than the inflation rate, the time to take a look at your future healthcare is now. Not in retirement, but if at all possible before retirement. If you've already retired, it still isn't too late. A lot of the cost can be controlled. We work out a plan how to cover the increased cost that we're all going to be faced with. And believe me, I think it's probably going to be the number one increasing cost that we're all going to see in retirement. You want to talk further? You can give me a call. 888-426-0177. 888-426-0177.
Welcome back to the Safe Money and Retirement Show with Jon Heischman. To contact Jon, the number to call is 1-888-426-0177. That's 1-888-426-0177. Once again, here's Jon Heischman.
Welcome back to the second part of the Safe Money and Retirement Show. I'm your host, Jon Heischman. Those that have missed past shows or want to hear a particular topic that I've done on past shows, they're available on my website, HeischmanFS.com. I'll spell that for you. HeischmanFS.com. And you can listen to those past shows at your convenience. I want to continue my discussion on being prepared for your health insurance coverage during retirement. Preparing for retirement, there needs to be an awareness of retiree healthcare issues. Usually, as I mentioned in the first part of the show, pre-retirement. And that depends on when you're planning to retire. And by the way, that's a big question for many as to when they can retire.
Hi, I'm Richard Karn, and you may have seen me on TV talking about the world's #1 expandable garden hose. Well, the brand new Pocket Hose Copperhead with Pocket Pivot is here, and it's a total game changer. Old-fashioned hoses get kinks and creases at the spigot, but the Copperhead's Pocket Pivot swivels 360 degrees for full water flow and freedom to water with ease all around your home. When you're all done, this rust-proof anti-burst hose shrinks back down to pocket size for effortless handling and tidy storage. Plus, your super light and ultra-durable Pocket Hose Copperhead is backed with a 10-year warranty. What could be better than that? I'll tell you what, an exciting radio-exclusive offer just for you. For a limited time, you can get a free Pocket Pivot and their 10-pattern sprayer with the purchase of any size Copperhead hose. Just text WATER to 64,000. That's WATER to 64,000 for your 2 free gifts with purchase. WATER to 64,000.
By texting 64,000, you agree to receive recurring automated marketing messages from Pocket Hose. Message and data rates may apply. No purchase required. Terms apply. Available at pockethose.com/terms.
If you work as a manufacturing facilities engineer, installing a new piece of equipment can be as complex as the machinery itself. From prep work to alignment and testing, it's your team's job to put it all together. That's why it's good to have Grainger on your side. With industrial-grade products and next-day delivery, Grainger helps ensure you have everything you need close at hand through every step of the installation. Call 1-800-GRAINGER, click Grainger.com, or just stop by. Grainger, for the ones who get it done.
Helping clients determine when they can retire is one of my favorite things to do, not only from a financial point, but from preparedness. Are you ready for retirement from both aspects? So let's say your goal is to retire at age 65. When you turn 63, it's important to sit down, project actual cost. For couples, those costs are doubled. There are no health care discounts for couples. Unfortunately, we need to talk about cost directly related to Medicare, including premiums and copays, out-of-pocket cost for those items that Medicare doesn't cover, as well as cost for unexpected events. I like to use not only a rate of inflation estimate on how those costs are going to increase, but a little bit higher than average rate in addition to other retirement costs, possibly 2 to 4 times the consumer price index. Now, that might be a little high, and many planners don't want to use those numbers because they are a little bit higher. But in my opinion, it's a reality. If you don't project those costs during retirement, factor in inflation, add a couple points or two, there could be a big surprise as far as additional cost that you weren't counting on or you didn't allow for in your budget. Get serious. Dig into specific Medicare plans and get assistance enrolling for Medicare, which you're eligible at age 65. But I think it's important to start taking a look at options at age 64 help eliminate stress and emotional time. Now let's go into actual retirement. Studies have shown that a 65-year-old couple about to retire will need around $220,000 to cover overall medical cost in retirement. There are a few healthcare expenses that can expect almost immediately once a retiree gets Medicare. I'll give you an example. Medicare Part B, which covers outpatient care, preventive and ambulance services, medical equipment, will cost each person approximately $1,260 per year. The Medicare Part D drug program, this benefit is going to cost an additional $580 per person per year. Medical expenses, usually somewhere in the neighborhood of $5,000 per person at the start of retirement. But this estimated figure largely depends on the health condition of each individual. The good news is that this amount is something retirees can have saved up front, but also something that can be used and funded as they continue to go through retirement. Now, this is approximately the annual consumption rate and is a much easier number for me and my clients to get our hands around. As we age, healthcare costs typically continue to increase beyond even inflation, mostly because with age brings more sickness and typically more hospital visits. And let's don't forget about medication and more care in-home or in a nursing home. There are variables such as long-term care insurance or a plan to fund long-term care coverage. This could be an additional premium for a long-term care policy unless we put together a plan that's going to reduce these premiums or eliminate them altogether. But in reality, there's really no way to pinpoint what long-term care costs are going to be. So hopefully I've given you another issue in retirement planning. And I don't know why this is overlooked and not accounted for in the retirement plan, but I see many plans that don't. It needs to be a part of every retiree's retirement plan, and it's one of those topics that needs to be addressed right up front. If you're a pre-retiree thinking of retiring in the future, maybe 3 to 5 years away, I'd like to help you with your healthcare cost and planning. Here's the number, 888-426-0177. Once again, 888-426-0177. During the remaining time I have left for the show this morning, I'd kind of like to switch gears and spend a few minutes and talk about IRAs and 401ks, other qualified retirement accounts, because it's not uncommon for those that have these accounts to move retirement accounts to other financial institutions. Very typical when there is a 401k rollover. There's a number of reasons why an individual would make the decision to move or roll over retirement accounts. Older account owners typically are concerned about risk and decide to move their accounts to a safer place. Preservation of your retirement accounts. And I think it's a very logical decision. Maybe not all of your accounts, but a good portion, or based on your risk tolerance, because of a concern about market corrections like we witnessed in 2008 and 2009. Another reason, your current custodian, meaning where your accounts are, possibly do not offer a competitive interest rate, while the new custodian may be offering a higher rate of return, or even the option to add a guaranteed lifetime income benefit. What if your current financial institution is showing some signs of insolvency and you're concerned about losing money? I mentioned guaranteed lifetime income. You may want to turn your account into guaranteed lifetime income, but your current custodian does not offer this option. Or you're tired of paying Wall Street's fees and think it's time to switch to a new no-fee account. And there could be many other reasons, or it could be a combination of reasons prompting you to make this change. It's so important to know your options as to where you can move money, transfer, or roll over. That's going to fit your risk tolerance and your risk capacity. I've been helping retirees with their transfers and rollovers for many, many years. It's important to know what options you have, what products, what strategies that's going to be best for you in retirement. It's so important today. There are so many that need this advice more so than any time in the past. So I'd like to hear from you, and we can discuss what's going to be in your best interest, not only now, but going into retirement. 888-426-0177, 888-426-0177. It's time for me to sign off. My time is up for the Safe Money in Retirement show. Thanks for joining me, and be sure to tune in next week.
The Safe Money and Retirement Show with Jon Heischman Sr. To get in touch with Jon, call 1-888-426-0177. That's 1-888-426-0177. For more information about Heischman Financial Services, visit their website, HeischmanFS.com. That's HeischmanFS.com. Join us again next time for the Safe Money and Retirement Show with Jon Heischman Sr.
Hi, I'm Richard Karn, and you may have seen me on TV talking about the world's #1 expandable garden hose. Well, the brand new Pocket Hose Copperhead with Pocket Pivot is here, and it's a total game changer. Old-fashioned hoses get kinks and creases at the spigot, but the Copperhead's Pocket Pivot swivels 360 degrees for full water flow and freedom to water with ease all around your home. When you're all done, this rust-proof anti-burst hose shrinks back down to pocket size for effortless handling and tidy storage. Plus, your super light and ultra-durable Pocket Hose Copperhead is backed with a 10-year warranty. What could be better than that? I'll tell you what, an exciting radio-exclusive offer just for you. For a limited time, you can get a free Pocket Pivot and their 10-pattern sprayer with the purchase of any size Copperhead hose. Just text WATER to 64,000. That's WATER to 64,000 for your 2 free gifts with purchase. WATER to 64,000.
By texting 64000, you agree to receive recurring automated marketing messages from Pocket Host. Message and data rates may apply. No purchase required. Terms apply. Available at pockethost.com/terms.
Breaking news from the stadium tonight as an anonymous fan foot the bill for 55,000 hot dogs, bringing that sweet tubed meat to everyone in attendance.
Free dogs! Yeah!
55,000 hot dogs? What does that even cost?
While the identity of this Frankfurter philanthropist remains anonymous, their all-beefy generosity will go down in history.
The new Mega Millions. More to win means more to give. How you spend it is up to you.
Yeah!
For game odds and details, visit sceducationlottery.com.